Hello everyone, my name is Valerie Iovine Rogers. I'm a physical therapist that treats the Ehlers-Danlos syndromes, as well as the hypermobility program director at Mount Sinai. But really what makes me the right person to come up and talk about mental health is my own experience living with Ehlers-Danlos syndrome. And I'm a healthcare provider that's very open about talking about these things. I find that it helps us have more productive communication. So if anybody has any questions, I obviously don't mind talking about my own experience, as I'm going to do a little bit today. So I wanted to start with congratulating you on getting here today. Whether you're tuning in live or recorded online, or you're here in person, look what you're doing for yourself right now. I know that sometimes the mental aspect of things get really hard. It's easy to fall into an apathetic state and let self-care go to the wind. But whether you realize it or not, taking the time to attend this presentation is a stroke of self-care and deserves praise. Which leads us perfectly into my most passionate part of this topic, which is self-pride. So I actually had this whole technical presentation all ready to go, but when I was finalizing things, I really wanted to be upfront that I'm really not the mental health therapist here, but rather an empathetic human that can relate to your battles. And so that's what taught me how to help myself, and that's kind of what I've been using to help some of my other patients as well. So not my degrees. So let me note that this is not a substitute, of course, for any therapy sessions, but rather a presentation about how to talk to yourself and an empowering moment to realize that you have the power to reframe your mind and be proud of yourself. If there's something that we could do that would help you feel better as part of your medical management, we'd all do it, right? You go through this life with this weight that you carry that makes everything that you do harder living life with one of the Ehlers-Danlos syndromes. If we could unpack and take out one of those heavy items in the backpacks that we lug, I have to say I have a feeling that just about all of you would agree to doing that. So this is the first item of reframing. Addressing and prioritizing your mental health is part of your medical management. So I know, cue some of the eye rolls. I get it because I've been there. Actually, people telling me to manage piece of my mental health was actually an infuriating part of my journey. And whether it was from doctors before understanding my illness and blaming my symptoms on it, or it came from a phase where mental health actually felt like a triggering word for me. I remember in PT school, we were learning about some chronic pain and how to approach these patients. If you made it to my first presentation this week about thriving and flourishing with chronic pain, some of this may sound a little bit familiar, but we're going to talk about central sensitization. It's a condition where the nervous system associated with the development and maintenance of chronic pain. When central sensitization occurs, the nervous system undergoes a process leading to amplification of pain signals. Some features of central sensitization include hyperalgesia, or increased sensitivity to pain, allodynia, where normal, non-painful stimuli can cause pain, persistent pain, homuncular smudging. That's why I have this picture here. That's your homunculus. It's a brain map. And when somebody has chronic pain, those borders get a little bit blurred and it gets hard to define. So if you have pain in one region, it may bleed over to something that's otherwise unaffected. And finally, we have temporal summation, which is where repeated stimulation at a constant intensity can lead to progressively worsening pain. And so when I first learned about these things, I was unable to see a way that this increasing pain wasn't a fault of my own. It was coming in my head. It was me. Maybe I'm a little crazy. And these actually all played a really big role when I felt like my symptoms of EDS and my symptoms of mental health started to blur together and I couldn't detach the two. So time for a reframe. I learned a bit more about the mechanisms behind central sensitization, and I'm going to share that with you today. So we have neuroplasticity. The nervous system is highly plastic, meaning it can change and adapt. In central sensitization, there are changes in the way the nervous system processes pain, involving both peripheral and central nervous system pathways. There's increased excitability. There's an increase in the excitability of the neurons in the central nervous system, particularly in a region called the dorsal horn of the spinal cord. This leads to enhanced transmission of pain signals. We have decreased inhibition. Normally, the body has mechanisms to dampen pain signals. In central sensitization, these inhibitory pathways are less effective, allowing pain signals to be amplified. There's also chemical mediators. Certain chemicals, such as neurotransmitters or inflammatory cytokines, play a role in the process, and these chemicals can also enhance the sensitivity of the neurons to pain. So after learning a bit about all these very real, very evidence-based reasons why I was feeling this way, I was beginning to tease apart the reasons that this was not my fault, it was rather happening to me. Sorry about that, my slides weren't advancing, we've got it now. I started to use my knowledge as power to understand, and I want to defy some of these mechanisms. I was still becoming quite triggered when I'd complain of some pain, and whoever it was in my circle would ask me how stressed I am and what that had to do with it. But over time, I started to see that the stress wasn't my fault either, and it's also a response of the nervous system. But yes, I completely do have anxiety and chronic pain, but not that my chronic pain is my anxiety. But how on earth would someone be able to live in a body where everything is in chronic pain, not know what's going to happen when, and not know what plans I can commit to or what I may need to bail on, what tests I may have that day that I'm simply not up to, and not be anxious? So the acceptance of my justified mental health battles were the first step in managing them. It also helped me to see all of the ways my mental health was physiologically affecting my very real, very physical pain. All this was the backstory to say, remember when I was saying if there's a piece of medical management we could do to get our hands on to make us feel better? Prioritizing and seeking mental health is a part of that medical management, like I keep saying. So often we are made to feel that the mental side is a whole other piece. Maybe it's less medical feeling to some of us, but truly the way we prioritize taking our medications, doing PT, wearing braces, resting to manage EDS, managing mental health should also be one of the aspects that should be seen as a non-negotiable piece of your medical management, without being made to feel that your physical pain is caused by your mental health. Maybe it's reversed. The pain and symptoms can cause mental health battles, but nonetheless, both aspects very real and very important. Managing mental health isn't easy, of course, but there are a lot of options. You can see I made a word cloud of a few of them. There's different help options out there for everyone. Not everyone will respond the same way to the same method, or even within the same method. Not everyone will like the same therapist or the same style of therapy. Not everyone will respond to the same medication or the same dosage of the medication. So the help options here are really to harp on the importance of self-advocacy and really tracking your symptoms and your moods, because you shouldn't assume that the first few things that you try are necessarily the right fit. Something I can point out here, though, is that going through it alone is typically not the right fit. So let someone in, but I know what you're going to say. Feeling like a burden with chronic illness is nearly inevitable. A lot of us have these thoughts. Sometimes it feels inarguable, right? Someone has to help you do all of these things, and they're worried about you. And if that's a fact, then how is it not burdensome? And I get that. But the thought will have more negative impact on you than anything else and may lead to you not asking for the help that you need. And that cycle of isolation will worsen the condition at hand in itself. So I urge you to think of it as a strength, that you are willing to seek help, and that those around you offer it want to. They will feel more fulfilled that they are able to offer you some help with all that you deal with. It would be a burden to them to feel helpless. And so rather letting them in is a way to make your life easier and theirs. So this is a reminder here that life is to be lived, and to do that you have to enjoy it. So yes, there are common things recommended for self-care: mindfulness, exercise, sleep, healthy eating, hobbies, social connections, limiting screen time, but ultimately self-care is an individual experience. So what matters is what makes you feel like you care about yourself. Is it getting enough sleep? Stop caring about the vacations that other people go on. Fueling your body with what it needs, and that can apply to both your exercise and your food. But also remember that the things you love to do is self-care. So no, self-care isn't selfish, and you can only do so much if you aren't filling yourself up first. In an old form in a PT clinic that I worked in, it asked what the hobbies were for all of the patients. And I found that a lot of my patients with EDS had a hard time filling that in. And actually so did I, until I gave myself credit that hobbies are not a multiple choice question. You need to pick them. You don't need to pick the ones that everybody else is saying. And you also need to do what feels like it fills you up. So I ask you right now, if you can think of your hobby, that your homework is to find what you would do to fill your time ideally that would make you feel best. The follow-up is sticking to it, making time, and pacing your energy to allow yourself to do that thing. The same goes not just for physical therapy, but movement in itself. The follow-up, again, is sticking to it, making time and pacing yourself to allow yourself to be able to do these things. Movement does not have to be the dreaded workout or the sport that causes you pain. I'm here to say, even as a physical therapist, there are definitely exercises that if you came in based on an evaluation, I may be able to give you that can more effectively help you manage your pain and your symptoms. But ultimately, what's most important is that it's an exercise is the best fit for you if it's the one that you enjoy. The reason I say this, even if it's out of the box, is finding what you like and adapting it to where you are and your needs is the key to compliance. Consistency with movement has all the benefits I could talk about forever as a physical therapist, but also for managing your mental health. The movement you enjoy can be the missing piece to your management because of the physiologic changes it makes. And the one I want to prioritize talking about today is the endorphin release. So let's pause here for a second. If there's a chemical that you guys could get your hands on, it's a natural painkiller and a mood elevator, what would you do for that? I've got news for you. That exists, and that's what endorphins are. Your body releases them with exercise, improving your feelings of well-being, and you just have to find that method of movement that you enjoy enough that you can keep doing to reap these benefits. But having grace with yourself that small things count as exercise. You don't necessarily need to be going at max force to achieve these benefits. Something nice and simple will do the trick as well. So you have the power to create your own medicine inside your body with movement. Something else you have the power to do is lift yourself up, but of course, much easier said than done. But I want you to picture someone that you love very much. Are you picturing that person, and do they make you smile a little bit just thinking about them? Now imagine that they deal with everything that you do, and you say to that person that you love very much exactly what you tell yourself sometimes. Would you tell them maybe it's not that bad, or maybe you're making it up, or maybe it's not that big of a deal, you're worth less because you deal with more? Absolutely, you would never. So they don't think the same either, and I don't want you to talk to yourself that way. So now let me pose the question, what would you tell someone you love with your whole heart if they did battle your battles? Would you tell them that you're proud of them for all that they can do despite their struggles? Would you tell them that they impress you every day, that they are strong, and that you're grateful that you have them, and that you would stand by their side no matter how hard the battles get? This is real and scary, and it's okay to feel scared, but that you've got this. Well, give yourself the respect to only speak to yourself the way you would speak to the person that I told you to imagine. Something I left off saying that I want to hear you guys say to yourself is this is real, and it's scary, and it's okay to feel scared, but that you've got this. Look around this room, or if you're at home watching, think about how many people logged on and are watching right now, and I'd bet most of us get this statement. It's so very normal to feel scared, anxious, or even depressed would be very normal. The definition of depression is the loss of something meaningful. And people with rare chronic illness lose the ability to predict what each day will be able to look like. So it's very normal to battle with this mental health. Allow yourself that grace and don't isolate yourself. Instead, let's use this community of others going through so much like you and use them as a support, in addition to seeking professional help, and allow you to learn how to combat some of these thoughts that get us down. So I want you to reframe your mind. I know we're all probably guilty of that yet another thing I can't do, Eeyore moment, right? But the most important thing I'll have said this entire presentation is give yourself some credit. What you're living with every day is hard work. Caring about yourself, despite what hard work it is something to appreciate and be proud of. Then add in if you care for a job, a room, a house, a friend, a parent, a child, a pet, a plant. All of these things are added feats. You deserve credit and self-pride for wanting the best for yourself, even in the hardest moments when it's hard to care. You are here, so this applies to you. Give yourself that credit. So this is the moment that one day becomes day one. You are here, so thank yourself for that, and the work that got in to get yourself to sit down and listen. Action creates momentum, and momentum creates motivation. You're taking control of your disease because you showed up. This is your moment, so welcome to the next chapter of your management. And if you speak to yourself the way I am speaking to you right now, you will become unstoppable. So think about how far you've come, and you've made it through 100% of your worst days because you are here, and now we get to see what happens when we keep going. You deserve this, and it's time to reclaim control over what you can. You will have bad days. You will have some days where you fail on your goals, but you will pivot and you will keep going, and every time you get to reclaim yourself as a fighter, and you deserve to feel good, proud, and happy. We can do this one step at a time. So you are worthy of what is possible. And let's be honest, every single one of us know the mind trap we can fall into when we let this get the best of us. But what happens if we always keep going? What if we challenge our worried thoughts and remind ourselves of our strengths? I invite you to stop resenting the struggle long enough to see what it reveals about you and fall in love with and be impressed with that version of yourself that can do that. The version of yourself lives in the work you are capable of. So let this reignite your fire, and it may be messy sometimes, but it's okay that way, as your life is your masterpiece, and it always feels a little messy, but you can develop the skill to see the beauty in taking control of what otherwise feels so disgusting sometimes. My cousin once reminded me that pearls, a symbol of such beauty, are made from grit, but full of grace. So what if we handle our battles with all of the grit, yet all of the grace we can muster? Sometimes, like our illness, the progress we made can be invisible, but you are doing it. So this is the bracelet that she gave me, and I want to share it with all of you. You are unshakable, not because you don't know pain or failure, but because you always push through, because you always show up and never give up, because you believe anything is possible no matter the odds. And perhaps what makes you beautiful has less to do with what lies upon the surface and more to do with what lies within. You aren't beautiful just because of your appearance. No, you are beautiful because the way that you choose to live and love, and in the way that you embrace all of life's experiences, good or bad. In your willingness to bend, but never break, and in your courage to believe that the darkness can't hold you as long as you continue to create your own light. You are just like a pearl, made of grit, but full of grace. You are unstoppable. You know it's not what happens, but how you choose to respond, with perseverance in your mind and passion in your heart. So I want to leave you with that beautiful sentiment, and I hope that you listen to that and you are actually proud of how much it really resonated with you specifically. You are made of grit and grace. Strength is wanting the best for yourself, and like I said, you're here, so I can say that you want that for yourself. I can also share something that my therapist told me a lot, and that was that the best predictor of the future is the past. And we've already said it, you're here, so you've made it through 100% of your worst days, so you've got this. Knowing what the word resiliency means versus knowing how it feels is two different things. And I can tell you in words, resiliency is the capacity to recover well from difficulties and adapt well in the face of adversity, trauma, tragedy, or significant sources of stress. It involves a combination of mental, emotional, and behavioral flexibility and strength that allows individuals to navigate challenges, maintain well-being, and to continue to function effectively. Resiliency is not just bouncing back from tough situations, but also about growing and improving one's ability to handle future challenges. Only you can feel what it feels like to call yourself resilient. I found that my patients that deal with the most are often the most humble bunch, and they don't realize these things as powerful personality traits that they are. I've asked some of my patients, why aren't you more proud of what you're going through? And they say that they have no other choice, that being strong or tough or resilient is the only option. But what deserves credit is that that's not true. There are many that couldn't handle all that you do, or some that would wallow in their pain rather than getting their butts over to a conference and listening to all of the aspects that they can help manage their disease, including mental health. So let's do everything we can to take control in a life where we control so little. Take the steps to manage your mental health so you can feel like you again. Seek help professionally and seek the power within. Thank you for listening. If anybody has any questions, feel free to reach out to me. And a huge thank you to the Ehlers-Danlos Society for coordinating this amazing conference. Thank you.